Good day, and welcome to today's webinar. Medicare is just around the corner. This webinar is designed to provide you with general information about what happens and what you need to do when you reach age 65 and Medicare eligibility, but plan to continue working as an active employee. This webinar is not designed to answer questions about when you retire, because our website, www.healthbenefitsprogram.ks.gov, has an entire section for retiree benefits with information and resources for members inquiring about retirement benefits. This webinar is designed for members who are still planning to work and have finally reached the age where you qualify for the Medicare benefits available to you. Now that it's just around the corner, you start to have questions and wonder, what do I need to know? What forms do I need to complete? What if I want to keep working? What if I plan to retire? Does being eligible for Medicare change my current benefits? How many different parts of Medicare are there, and which parts do I need? All these questions about Medicare eligibility when you turn 65 years young will be discussed during this presentation. First, what is Medicare? Medicare is a national government program which began in 1965 under the Social Security Administration and is administered by the Centers for Medicare and Medicaid Services, or CMS. It's primarily designed to provide health insurance for Americans age 65 and over, but also for people with disability status determined by Social Security. When you become eligible for Medicare, even if you are still working, there are certain steps you need to complete to either retain your current coverage or to enroll in Medicare or some parts of it. Let's discuss becoming eligible for Medicare first. There are three main parts to Medicare: Part A, Part B, and Part D. All of these parts have different benefits, so you need to know what they cover and where they fit in your benefit package. Eligibility begins the first of the month when you turn 65. So, for example, if you turn age 65 on February 12th, your Medicare eligibility begins on the 1st of February. Part A of Medicare covers primarily hospital and institutional charges and services. Part B is designed to primarily cover the physician services or professional component of your health care. Part D is designed to cover prescription benefits for you. Typically, Part A is provided to most individuals at no cost. The cost for Part B of Medicare can vary depending on things like income, when you actually enroll, and other factors outlined by Medicare. The cost for Part D can vary depending on your needs and which plan you select for your prescription benefit. If you are still working when you turn 65, or if you are considering whether or not to continue working, here are some helpful guides for you. Typically, the SEHP benefits team will send you a letter 1 to 2 months before you turn age 65. This letter is called the TEFRA Notice. TEFRA stands for Tax Equity and Fiscal Responsibility Act, and this notice outlines most of your options for you regarding Medicare. If you continue to work and wish to remain on the SEHP benefits, you will need to complete the TEFRA form and return it to the SEHP. While you're still working, you can elect to have Medicare Part A, typically at no cost, and still have all the benefits under the SEHP program. Since Part A does not cost anything for the member, many people elect this option. the Part A benefits of Medicare become a secondary coverage to your SEHP benefits. If you continue to work, you may also waive your enrollment in the Part B and Part D of Medicare. Since these two parts have a premium cost you must pay to enroll in them. Waiving Part B and Part D while you are still working does not cause a late enrollment penalty because you have completed the TEF reform and returned it to the SEHP. When you eventually do decide to retire, the SEHP will provide a letter confirming your coverage through the SEHP, so Medicare does not impose any penalty at the time you enroll in Parts B and D. That's why completing, signing, and returning the TEF reform is such an important first step. Now, when you reach age 65 and are still working, you may decide to enroll in Medicare Part A. There are some things you need to consider changing in your SEHP benefits. A key consideration is if you have a health savings account, HSA. If you have an HSA, you need to stop contributing to your HSA the same time your Medicare Part A coverage begins. So using the example provided before of turning 65 on February 12th, the Medicare Part A coverage would begin on February 1st, and you would need to stop your employee contributions to your HSA by that date. For the employer contributions, you will still have an HRA, where those funds will be contributed on your behalf. If you wish to continue making contributions as an employee, you will need to use the Flexible Spending Account, FSA benefit offered through the SEHP benefits for your own contributions. IRS regulations do not allow an individual to contribute to an HSA when they are enrolled in any part of Medicare. SEHP members who have Plan A or Plan J do not have an HSA, so this situation does not apply to them. Some people choose to waive all parts of Medicare while they are still actively at work, including waiving Part A, even though it is no cost to the member. In this situation, you may continue to have an HSA and contribute to it while you are still actively working and haven't retired yet. However, there are some key points to remember if you make this choice. When you start considering retirement and you are Medicare eligible and you still have an HSA to which you are contributing, you must stop contributing to your HSA 6 months prior to signing up for Medicare or Social Security. This provision is very important to remember if you decide to waive all parts of Medicare and keep an HSA. Failure to stop these contributions at least 6 months prior to signing up for Medicare or Social Security can result in potential tax penalties to you. So, as an example, if you are already 65 years young or older and have decided to retire in December, and you sign up for Medicare in September in anticipation of your retirement date, the 6 months prior will be measured from September, which is when you signed up for Medicare, not December when you actually retired. As a rule, it's important to start planning and making changes well in advance of your retirement if you are over age 65 and have an HSA plan. An important tip here is to remember to reach out to the SEHP Membership Services team when you start planning to retire so they can assist you in your choices. Medicare, or CMS, will typically send you information and notice about 90 to 120 days prior to your 65th birthday, and that information will outline many of these options you will have available to you. That's when the fun begins. Don't worry, though, you have lots of places to go for help and to get answers to your questions. The CMS site and general information provides a very comprehensive resource for getting started. The handbook titled Medicare and You is also a great resource for you. The link above to the general information on eligibility guidelines and enrollment is also a great location to get answers. Perhaps most important for SEHP members, our SEHP Membership Services team is here to help you and work with your unique situations to provide you with guidance as well. You can call or email them and schedule a time to go over the steps you need to complete while you are still working, and they can also assist you when you are ready to consider retirement. So, when you reach age 65, and whether you decide to retire or keep working, we are here to help. Thanks for watching, and we wish you good health.